July is National Minority Mental Health Awareness Month, shining light on the unique struggles that minority communities face regarding mental illness. 13 on your side's Joshua Vincent joins us live this morning from Medical Mile with that and a key change coming this weekend to the National Suicide Hotline. Josh, good morning.
Hey, good morning, Emily. You know, it is well documented when you're talking about mental health or just healthcare in general. Inequalities and stigmas separate communities of color from others, and that especially rings true when you're talking about mental health. That is why July, being National Minority Mental Health Awareness Month, is so important. I spoke with one expert about the challenges minorities face when dealing with mental health. She says when it comes to Black African Americans, it is so important for us to deal with the ongoing trauma we face, even if we don't realize it.
The trauma and the negative experiences didn't end with slavery. We went from slavery to Jim Crow to civil rights to mass incarceration, to, police killings. And so the trauma has just never stopped. When you're looking at a compound experience with being devalued and dehumanized, regularly in your life, daily life experiences, then it is traumatizing. It's exhausting.
And with trauma, that can lead people to think about suicide. A recent study by the CDC revealed although the overall rate of suicide in the U.S. decreased by 3% in 2020, the rate of suicide among people of color and young people had increased. And just last year in 2021, more Black adults attempted suicide than any other racial or ethnic group. Green says confronting that trauma in a healthy way and also understanding that self-care is key. Those are the ways to get closer to healing. Emily?
Some really important statistics there, Josh. And another important note for everyone this morning, suicide prevention help for everyone undergoing a change this weekend. What should people know, Josh?
Yeah, that actually starts tomorrow on Saturday. The National Suicide Prevention Lifeline is going from a lone 1-800 number to a three-digit number of 988. They said that would make it easier for people to remember. It used to be a time you could only dial that 1-800 number. Now you can dial and text this three-digit number, 988. They hope it's, simply to remember just like 911. And again, I just really want to stress, you can also text this number. That is so, so important, Emily.
Very important. 988 is that number. That was a lot of information, Josh. You can find all of that on our website, 13onyourside.com.